Welcome back. A Maui football player who played college football in Utah unexpectedly passed away last week. 23-year-old Abraham Reinhardt died from a condition called hyponatremia. Joining us this morning is Johanna McCroskey, nurse practitioner of family medicine at Adventist Health Castle. Johanna, thank you so much for stopping by, because a lot of people are wondering, what is hyponatremia?
Yeah, so actually hyponatremia in a nutshell is low sodium level in the blood. So salt or sodium is an electrolyte in our blood which is vital to the proper function of our body, particularly the heart, the brain, and also our skeletal muscles. And the level of sodium in the blood is very tightly regulated by the body, because either too much or too little can be very dangerous and even potentially fatal. It's also sometimes called water intoxication, and it can be caused by a number of different things, but in this instance, it's actually caused by drinking too much water in a short period of time.
So that's kind of like interesting, because a lot of people think, well, you need to stay hydrated, especially when you're playing football. And that's just kind of like an interesting concept where you shouldn't drink too much water too fast.
That's correct. That's correct, yep. So it's actually caused by excessive water intake. And those specifically at risk for this are endurance athletes who are drinking too much water in too short a period of time in an effort to prevent dehydration. And
yeah, you talk about athletes. Is this a common occurrence, hyponatremia, people having it?
It's actually relatively uncommon in the general population, but those at risk are endurance athletes, marathon runners, triathletes, that kind of thing.
Now, how would someone know if they're hyponatremic?
Symptoms of hyponatremia typically would be feeling nauseous, feeling lightheaded, sometimes even confusion, and late symptoms would be seizures and even coma.
And so how would someone say they have it? How can they avoid hyponatremia?
Yeah, so great question. It's actually, the good news is it's readily preventable.
Okay.
And so it's simply by not drinking too much water, basically. So the current recommendation is to simply drink according to thirst. So it's very simple, actually. Drink when you feel thirsty, and don't drink excessive amounts of water in a short period of time in an effort to prevent feeling thirsty.
And we're talking about off camera about how some people maybe would drink Gatorade instead of drinking too much water, or like I like to take Pedialyte after my workouts. Is that okay?
Yeah, absolutely. You can even alternate Pedialyte, Gatorade with water as well. But again, you can overdo it. All good things in moderation. So like any good thing, it is possible to overdo it. Just drink as you feel thirsty. Use common sense. Listen to your body's signals. And drink, if you're engaging in a long period of strenuous activity, just drink small amounts of water regularly during your workout as you feel thirsty.
So what if someone is out there and they're thinking, do I have hyponatremia? And if they're experiencing it, what should they do?
Yeah, great question. So if you're experiencing these symptoms, or say you're at an athletic event and you notice someone else experiencing these symptoms, the first thing you want to do is stop what you're doing and seek medical attention. Many endurance events, such as marathons, will actually have medical staff available for situations like this. So first thing would be stop what you're doing, go seek medical attention.
Because the football player, he was suffering from cramps and pain, and that's why they rushed him to the hospital.
Yes.
And it's just one of those things. So thank you so much, Johanna McCroskey, nurse practitioner at family medicine at Adventist Health Castle. Thank you so much, because everybody was wondering, what is this hyponatremia?
Yes, it's readily preventable. Don't drink too much water. Drink water, not too much.
All right, thank you very much.